Today we're going to do a follow-on video about disc injuries. Last week we talked about the very acute injury or the disc bulge, where the vertebra has lost its optimal relationship on top of its disc. It's not sitting plumb center and it's creating some form of swelling of the disc, potentially into the small gap where the nerve exits, thereby creating anything from acute lower back pain with muscle spasms right into sciatica and severe leg pains. Today, however, we're going to talk about the more advanced or the more chronic version of that injury. And that's where we have some form of degenerated disc. Degeneration meaning worn out. On an x-ray or a scan, this will typically look like a very, very thin disc, and it's almost converged to the point of being bone on bone. Now in this person, first and foremost, the injury started out like the disc bulge did last week. This has simply been an injury that has never been corrected over time, and the body has simply worn out that injured disc. Much like a balding tire, it is simply worn out over time with excessive use. If it's an uneven wear on a tire, it suggests there's some form of unbalanced mechanics going on with the wheel alignment. In the spine, if you have one disc that wears out prematurely compared to the others, it's suggestive that you have had an injury there for an extended period of time that the body has not been able to resolve by itself, and the best solution has been for that disc to degenerate over time. Now, this chronic injury in many cases does not create leg pain. It does not even create particularly acute lower back pain. What the patient typically presents with is that dull, constant, nagging ache in their lower back. What is significant about this injury is the degenerated disc. Typically this person feels better in the morning. The reason they feel better in the morning is because overnight, when we're laying down and not weight bearing through the disc has a chance to rehydrate and renourish itself, which means when you first wake up, partly you're a little bit taller and a little bit heavier, is because of the extra fluid in your discs. That's a normal phenomenon. If you put a little bit of extra fluid into a degenerated disc, it typically feels better. As a result, come late afternoon into the evening, the degenerated disc, after being standing and weight bearing all day, whether that be bending and lifting, whether that be sitting down behind a desk, the degenerated disc is at its least happy. It will commonly create a significant amount of stiffness and tightness through the lower back. It can even start to create some of those chronic imbalances through the glute muscles, hamstrings, potentially even to the hip flexors and groin. So the degenerated disc is something that we see on a regular basis. It's not something that we're going to create massive levels of change to on an x-ray. In other words, we're not going to make the disc look big, fat, juicy, and healthy. However, we can help that individual segment work at its highest level. In many cases, by creating that change, we're able to alleviate that dull ache, which is, no pun intended, a pain in the butt. The degenerated disc, it's a variation, it's a chronic friend of the disc bulge. Much of the mechanism, however, is all still the same.